My name is Angelica Seha. I am the organizer for the Oregon State Hospital. I primarily work on the Salem campus and sometimes helping out with Junction City and Pendleton Cottages. We're here to talk to you about the hazardous position retirement bill that's going to be heard in our short session in February. And I have Anthony from our political team who's going to introduce himself. And together we're just going to go over the bill.
Hello, everyone. Thanks again for taking time out of your day to listen to this presentation. My name is Anthony Castañeda, and I am part of the political team for SEIU 503. So I work as a political and policy strategist, and my portfolio includes the state budget, public sector issues, and workforce development. And we're going to go ahead and just get straight into the presentation. So today we're going to be talking about hazardous position. It's a bill that SEIU has been working on since 2017. We introduced it last session in 2023. However, it died due to that walkout. So we're trying again this session. So just a little bit of background. For those who may not be aware or need a little remembering, Oregon has a part-time legislature. That means that our elected officials only go down to Salem for part of the year. And so what we call them is a long session and a short session. The long sessions are in odd years and last roughly 6 months. And during even years, such as this year, we have what is called a short session, which convenes for roughly 6 weeks. And this year, the short session is going to start on Monday, February 5th. And unlike the long session, that is considered a marathon, the short session is really a sprint to the end, seeing as we only have 35 days to get all the business done. Now, kick it back for Angelica to talk a little bit about the policy.
So, what is this bill or legislation going to do? It's going to create a hazardous position classification within PERS for workers who have been exposed to serious physical harm or psychological harm, but they don't necessarily meet the definition of public safety officer under the federal code. And that would be what we all know as police and fire. It's going to limit the classification for the Oregon State Hospital workers to people who work directly with patients and 911 operators. And I know that's going to cause some questions, and we're going to get into that in a little bit. It's also going to lower the age of PERS workers who can retire with full benefits from the age of 65 to 60, or lower the years of service from 30 to 25. And it's also going to establish a 1.8% multiplier calculated with the years of service and average salary. Anthony, go ahead.
All right, as Angelica was talking, when we're talking about definitions within the statute, those definitions that need clarification trigger this process called rulemaking. And so if the governor signs the bill into law, the stakeholders of the legislation will move into the rulemaking process. Those stakeholders will include us, SEIU, AFSCME, the Oregon Health Authority, and the Oregon State Hospital. During this process, the technical terms or clarifying definitions are negotiated and defined. So as Angelica had said, Oregon State Hospital workers who work directly with patients, the definition of who works directly with patients would be defined during this specific process. We use this process because it allows for flexibility when definitions or job titles change. The fields often evolve or change, or there's new requirements that require new positions to be created. So this is just a mechanism to allow us to be flexible in the future and allow us to come back and make those changes rather than going to the state constitution that requires a 2/3 vote from the legislature to make any real changes. So this is just a streamlined process to help us navigate this in the future. And so to qualify for benefits and retroactive benefits, here's the slide. So the hazardous position classification would take effect on January 2030. An employee must work 5 continuous years in a qualifying position. And employees can establish eligibility for the classification using years in a qualifying position between 2019 and through 2030. So you can use up to 11 years to establish that 5 year years of service. And there's also some exemptions built into the policy as well, because we know that the hospital is seriously understaffed, and employees often must take some time away due to injury or illness. So one exemption is the unpaid leave while receiving short-term and long-term payments for leave. So this could be disability payments. And another exemption is when a worker works in a hazardous position while also holding another position within the hospital. So think about when folks are asked to work in rotation or asked to wear multiple hats at the same time. Now I could get back over to Angelica. You're muted.
Was on mute there. So we have a few scenarios to help explain some qualifications or what we're going to have people be qualified under. So one example is Joe worked in a hazardous position from the year 2019 to 2024, but then he moved to a non-hazardous position. In 2030, he would be eligible to begin receiving the full benefit of the hazardous position category that he accrued because he reached that benchmark of 5 years while in the hazardous position. Example number two, Joe began working in a hazardous position in the year 2025 and still works in a hazardous position in the year 2030 when the new category becomes operational. As he's now already served 5 years in a hazardous role, he is eligible to receive the benefits of the new category. Example number three, Joe worked in a hazardous position from 2019 to 2024. He left the role until 2030, then takes a new qualifying hazardous position. As his eligibility was already established between the years 2019 and 2024, he is eligible to receive the benefit from this new role. Oh, back to Anthony. You're on mute, Anthony.
Okay, so what does this actually mean? The level of benefit is determined by years of service, the pension multiplier, and in this case, the hazardous position is on par with police and fire in PERS. For example, let's say Jane works as a mental health security technician and earns an average salary of 50,000 over a career of 15 years at the Oregon State Hospital. The benefit would be additional to any other retirement benefits the employee may have or contributed to. So here's kind of the quick math. 15 years of service times the 1.8 pension multiplier times 50,000 for the average salary. This would be an extra $13,500 per year on top of any other retirement benefits the employee may have earned during their time in service. And so what does this mean for the public sector workforce? And what's the impact by the numbers? SEIU represents roughly 2,000 employees at the state hospital and represents over 80 classifications. AFSCME represents about 900 911 operators and roughly 300 doctors and nurses at the state hospital. So this has a potential to impact roughly 3,200 state employees who are currently in these roles that does make them carry a lot of psychological harm and trauma uh, as being part of the job. And so things are going to be moving quick starting February 5th on that Monday, and there's still ways to get involved. You may have received a text message asking you to take action, and these are just small ways and quick ways to really get your voice heard and remind legislators that we're watching the session and this is something that you support. So send a letter to your rep and members of the committee. This takes less than 3 minutes. You can take the member survey. This is information that we're distributing to legislators without any identifiers. So it's fairly anonymous in terms of how we present the data to folks. And you can also sign up to provide written or verbal testimony to share directly with legislators why this is important to you and how this can impact you. The last thing to do is you can call your rep or senator, even if it kicks you over to voicemail. A 10-second voicemail letting them know that this is important to you does go a long way. And with that, it comes to the end of our presentation. We hope that you learned a little bit more about the policy and the potential impacts. Again, my name is Anthony Castaneda.
And I'm Angelica Seja. I go by Angie. We have our emails listed down at the bottom. If you have any questions, please feel free to reach out. We'll do our best to answer any questions that you have. And you can also submit some of those written testimonies to us, and we'll make sure they get in.